Welcome to our practical session of the Cancer Conference today. I'm Joyce from Union Yoga Ayurveda, and conducting today's session is our Master Prashant, also from Union Yoga Ayurveda Singapore. Master Prashant holds a master degree in science of yoga therapy and has done his postgraduate in different departments of yoga therapy and cancer, like cancer, neurology, cardiology, and many, many more. He also holds a master trainer training students in yoga instructor course. His expertise in yoga therapy is shared in yoga therapy's training course with his students, and he has published a research paper in an indexed international journal in yoga therapy. So Master Prashant is also good in his alignment for beginners yoga to advanced yoga. And although he is good in his advanced posture, Master Prashant has the philosophy for following slow, simple, rhythmic yoga practice. Healing of body and mind is his main aim of yoga. His easygoing nature makes him a good yoga therapist, master trainer, and also a good routine teacher. And now let's us welcome our very own Master Prashant.
Thank you, Joyce, for your introductions, and I welcome you all for this international conference on the cancer to understand more about yoga and its practices. And especially like we are working on the yoga and the cancers together, and we are trying to correlate the practice of the yoga and its impact on the cancer patients. So first we need to basically understand how this yoga therapy is going to be works. If you look into the yoga, this is that yogena chittasya. Yoga start from the mind, Yoga basically start from the mind, and if you look into the concept of the disease in the yoga, they also says that disease also start from the mind. So your healing and disease, it is both start from the same level. So mind is the one which is the responsible for your problems, and mind is the one which is the solution for your problems. So if you look into the concept of the mind, basically according to the Patanjali, they says that the mind is something which is the part of your consciousness, and it is a bundle of the thoughts. But when these thoughts start becoming fast and it is start thinking negative, it's become the stress. So if you ask what is the specific cause of the cancer, there is no specific defined cause of the cancer patients. So cancer is basically an autoimmune disease in most of the cases. It is an inflammatory disease, but if you look into the what is the specific cause behind it, still science is working on it. So since it is the autoimmune disease, we can directly connect it with your lifestyle, with your mind. So stress and the mind has basically the big role to develop the autoimmunity inside the body systems. So if you want to heal this autoimmunity, you want to basically get the control on this autoimmunity, you want to prevent the cancer in your body, you have to basically start working on the mind. And yoga is the best practice which basically start from the mind, and this says that yogena chittasya. Yoga is going to be from your mind level. What happens in the cancer patients, basically what is the role of the basically the mind in the cancer patients? Whenever you are thinking so much, all the energy, all the prana, which is basically supposed to be balanced in your body from all over the body, but when you are thinking too much, the amount of the energy which is supposed to be flow all over the body to the particular organs and the systems, it is all being directed to the one side, and which is towards the head region. So when all the energy is moving towards the head region, it is basically giving the less energy to the other part of the systems, which can be maybe they have taken the energy to the mind from the liver, or they have taken the energy from the lungs, or they have taken the energy from the stomach, or they have taken the energy from the pancreas. Whatever the place is being blocked with that energy, that place will be affected. And in the beginning, when it is being affected, what will happen? They have the less energy in that particular areas, and these cells are basically not have enough energy. They are not able to survive. They are not able to support to your body. And then what will happen? They will start accumulating to that particular place. This place can be anywhere in the body. When this is start being accumulated to the one place in the form of, you can say that cancer cells, or you can say the form of dead cells, is become the cysts. And when, if you look into the stage 1 of cancer, the cyst size is approximately 2 centimeter. But when they go to the stage 2, the cancer size is basically 2.2 to 5 centimeters. So when these dead cells or these cells are being accumulated at the one place in the form of cysts, this will be basically take a part of the cancer cells, and they will be basically comes with the diagnosis of the cancer. So what we have to do in the yoga, we need to basically prevent, we have to basically prevent this energy block, we have to prevent the energy flow to the only one directions, and we have to prevent to make these cysts to be formed at one particular place. In order to do that, we need to basically practice lot of breathing practices, lot of pranayama practices, certain yoga postures which is really directly connected to the basically your particular organs. So if you are going to perform this asana practice, this pranayamas, and then also you have to do the some psychological practice which is called the meditation. So these practices will basically help you to direct the energy to your all over the body, not only to the one side. The energy will go to all over the body, from not to the only just head region, it will go to the every part of the body. When this energy is maintained, this energy is basically flowing smoothly, and this energy is the balance where all the organs will function properly. So if energy block, it will bring the impact on the physical level, and if they bring the impact to the liver areas, you may get the liver cancer. If they bring the same impact towards the lungs areas, you may get the lung cancer. If it is going to affect your pancreas, you may get the pancreas cancer. If it is going to affect your stomach areas, prana is not going there and the cysts are forming to that area, you may get the stomach cancer. So that's why we cannot say that what is the specific cause of the cancer and where you will get the cancer if you are following the same lifestyle as other people. So what we have to do is, this says that mana evam manushyaram karanam bandha mokshaya, means we as a human beings, we are binding because of our mind, and we can be free based on our mind. So whatever is the thought process going on, we need to basically change that. We have to basically change our lifestyle. So yoga has a big role in the cancer patients to basically help them to prevent the cancer, and also if they are the patient of the cancer, then we have to change the practice into the yoga therapy. So if you look into the yoga therapy concept, there is a IAYT, integrated approach of yoga therapy, which works on the 5 koshas. First is called the physical body, then second is called the energy level, which is called the pranamay kosha, then third is called the mind, which is the manomay kosha, then next is vijnanmay kosha, and ultimately is the anandamay kosha. So today, if you talk about the physical bodies, what we have to work with this yoga therapy on the physical body, we have to work on the immune systems. For the cancer patients, their immune systems becomes very weak. They also lose the weight when they are diagnosed with the cancer. They also, if they go for the like chemotherapies, they feel there is a lot of pain in the body, you know. So physically, what we have to do for them, for the physical level, first things we have to basically work on the immune systems. So what we have to do in the immune systems, we have to activate your thymus cells. We have the immunotherapy, so you can do the some back bend practices. Also, if you look into that glands, basically, which is especially for the immune cells, we have in the neck areas, you know. So we have to basically do some stretches here. Then we have the groins area, so you can do some like butterfly postures and all. This is going to basically activate your immune cells, which will help you to fight with these cancer cells. This is the physical level practice. Now let's talk about the pranayama. They are losing the weight, you know. In the cancer patients, see that most of the patients, they are losing the weight. So we can follow the left nostril breathing, which can activate their parasympathetic nervous systems, and they can make that energy balance, that energy flow will become smooth, and they will also maybe start gaining weight. Of course, the result will be very slow, but yes, there is a possibility to gain the weight when they perform the left nostril breathing. Then they can do the Nadi Shuddhi pranayama, you know, all these practices they can perform. Then if you come to the head area, which is basically the mind. So see, sometimes if you are like focused and you are stable, meditation is easy for you to perform. But if you cannot do the meditations, we have the chanting for that in the yoga therapy. What is the chanting we have? We have the akara, ukara, makara, omkara. But when we work on the head region, we work for the nervous systems, we work for the mind, then we basically prefer the makara practice, and also we can chant the omkara practices, which is going to resonate your nervous systems. And if your nervous system is resonated, it will basically activate your glands, and this glands is going to help and support with the enzymes and the hormones to support your immune systems. Then come to the mind level. So see, mind level especially for the any kinds of the patient, not just the cancer patient. In the yoga therapy, we believe in the counseling. What is the counseling means? Counseling means let the patient understand, let the patients know that what is the basically his lifestyles, what is the problem in his body, and how this yoga therapy is supporting to them. He need to believe whatever the practice he is doing. The moment he has accepted cancer as a part of his life, and he has basically doing something to fight with this cancer in his body, he will be able to survive longer. Till today, we will not say that yoga is going to cure the cancer, but yoga can be helpful to the cancer patients. And then for the Anandamaya kosha, if their 4 koshas are in the state of balance, physical body is balanced, energy is basically smooth and balanced in the body, mentally they are not being stressful, and psychologically they are understanding what is their problem in the body, and they are ready to change their lifestyles, they will survive longer, and their health also will recover faster. So this is the whole concept of the yoga therapy is totally based on this 5 koshas, which is called the Panch koshas. Also, if you talk about the mind, there is a practice which is called the MSRT, mind sound resonance technique, but which is a very long session. So the chanting is the part of that MSRT practices, but I'm not going to teach you the whole MSRT. We will teach maybe some chanting parts in the practice sessions. If you look into the energy level, there is a PET, which is called the pranic energized technique. So I'm not going to teach the full pranic energized techniques, but yes, I will teach some 1 or 2 steps out of that, which can be basically practiced by the cancer patients. And for the physical level, we are going to basically work on the few asanas basically, which is specific postures to activate your immune systems, which is going to basically activate your immune glands basically. So there is a thymus glands basically, we are going to activate this thymus gland, so we will be following the postures accordingly. Okay, so if you all are ready, we can basically go with the practice here, and I will explain that how this practice is going to be helpful for the cancer patients. So let's sit straight, keep the spine, head, neck, back straight in one line. Keep your eyes closed, spine, head, neck, back straight in one line. Try to sit on the tailbone. Close your eyes, feel the energy inside the body. Try to maintain the awareness through the body, mind, and energy level. Let's focus on the breath. Try to maintain the awareness to the tip of the nose. Try to prepare your body and mind for yogasana practice. And let's begin the sessions with the prayer. Join your both the palms together. Place the hands in the center of the heart. Om Sahana Vavatu Sahanam Bhunaktu Sahaviryam Karavavahe Tejasvinam Dhitamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. Try to feel the beautiful energy of this prayer. Try to maintain the energy in your body. Now gently bring the hands down. The meaning of this prayer is Om Sahanavatu. Oh God, please protect us both. This Prayer is between the teacher and the students. Sahana bhunaktu. Oh God, please nourish us both, whatever the practice we are doing. Sahviryam karvavai, whatever the practice we are going to perform, we should do this with the great energy. We should maintain the energy while performing the postures. We have to maintain the positivity. Tejasvi navadhitamastu. Whatever the practice we are going to do, it should be suit to our body, it should be protect to our body, it should be basically comfortable to our body, and it should be fruitful to our body and mind and the energy. And ma vidvishavahe, we should not hate each other. With this, let's start the practice sessions. Come to the standing position. Basically we'll start with the 2 breathing practices first, basically, which is working towards the chest area. So join your both the feet together, keep the spine, head, neck, back straight in the one line, and raise your both the hands up to the shoulder level. Try to bring your both the palms together here and maintain that hands up to the 9 up to the shoulder level. Now inhale, open your both the hands out, try to expand the lungs completely and maintain the awareness towards the breath, and exhale, try to bring your both the palms close to each other. Again, inhale, open your hands and try to expand your lungs completely. Maintain the awareness towards the breath. Exhale, try to bring your both the hands close to each other. Last round, inhale, exhale. Try to feel the beautiful energy and bring the hands down and try to keep the legs apart, hands hanging freely. Close your eyes and try to relax for a while. So see that when you see the cancer patients, they are very weak in the body positions. They are very weak, and so what is happening, sometimes they are basically not be able to do these practices in the standing positions. They are not able to sit even for the long time. So what you can do is same practice you can teach them in the lie down positions. Don't make them to like stand if they cannot stand, or if they can do with the wall support, it is fine. If they are not able to do it, try to make them to lie down, and they can do it on the mat itself, or they can do it on the bed itself. So this we have to maintain. So when you perform this practice, this is going to basically enhance the energy and try to remove the blockage in the lungs and let the energy go to all over the body to convert the glycogen into the energy, so your body will feel energized when you perform this breathing practice. I will go for the 2 more breathing practices. So try to bring your both the feet together now here, and let us go for the ankle stretch breathing practice here. So place your palms on the thigh and make the point at one point to be focused here. Do not close your eyes here, and try to synchronize the 3 things. First thing is your ankle movements, second is your hands movement, so you have to synchronize your ankle and hands movement. Second thing is you have to be focused at one point so your mind can be concentrated, and third one is try to synchronize the breathing between the mind and the body. So inhale, stretch your hands up. Exhale, bring the feet down and hands together at the thigh. Again, one more time. Inhale, stretch up. Exhale, down. Last round. Inhale, stretch up. Exhale, try to bring the hands down, and now keep the feet apart, hands hanging freely. Close your eyes and try to observe the changes. Stimulation followed by the relaxations. We have to give the practice to the cancer patient in this manner. First you have to give them the practice 1 or 2 times, 3 times, and then after that ask them to relax equally time. We have the problem because we are not resting, so we have to basically give them the more relaxation practices. The more relaxation practices they will do, their energy will increase in their body, and their body also will recover faster. Okay, so this was the 2 breathing practice which you can perform with the cancer patients. And now let us go for the 2 more chest opening practices to activate your thymus glands here. So what you have to do is basically come to the sidewise. Basically you have to basically keep your both the feet together and try to put the hand side of the body. So you can basically do the 1 back bend practices which is going to expand your lungs and try to open the chest from the basically your sternum bones here. So you are going to do stretching to the horizontal level in the sidewise. So try to place your palms on the wrist, let the 2 thumbs be behind and 4 finger pointing forward here. Try to roll the shoulders back and bring your both the elbows close to each other. Feet must be together and maintain that basically the firmness with your feet here, and then try to basically look up. Main thing is do not close your eyes, because when you do the back bend and if your body is weak, you might be feel giddy and you may fall down. So as a therapist, we have to basically they stand very close to the patients when they are doing the practice here. So try to put the hands on the waist region and inhale, slowly push the hip forward and try to just bend backwards. Do the gentle bending, do not force yourself to bend so much, and maintain there. Hold with the normal breathing. Go for the deep inhalation and deep exhalations. Try to feel the changes in your body. Feel the activation of your sympathetic nervous systems from the lumbar region, and try to make sure that your body is being completely stretched and your chest is open and your T cells are being activated. Try to imagine in your minds, but continue to breathe. Do not stop your breathing. Maintain the awareness to the practice. Hold for a while and now exhale and slowly inhale. Come back to the center. Keep the hands side of the body, legs apart, hands side of the body. Close your eyes and try to observe the changes. And now this time try to bring your focus 2 places. One is the lumbar region, which is the basically your sympathetic nervous systems, which will help you to boost the energy in your body. And then second is your lungs areas. You can feel that your immune cells are being activated, your thymus glands is being activated, and you are feeling the stress to all over the spine. And try to relax after that. Relax for a while and feel the changes. Now after that, slowly come back to the sitting position. So I told you I am going to teach you the 3 breathing practices. So if you come to the sitting positions, you can sit in the Vajrasana. It is not compulsory that you have to sit only in the Vajrasana, but it is recommended to do. If your patients cannot sit in the Vajrasana, you can modify the postures the way they are comfortable. They can sit. If they still cannot sit, you can ask them to lie down on the bed and they can perform the practice accordingly. So what you have to do is basically you have to basically place the hands on the thigh and go for the basically the breathing practices from the abdominal breathing, chest breathing and the clavicle breathing. I will tell you the impact of these breathing practices, how it is going to basically help in the cancer patients. And then after that we'll go for the full yogic breathing, which is called the Vibhagiya Pranayama. Basically Vibhagiya means section. So section 1, section 2, section 3, and when we all 3 together it becomes the full yogic breathing. And why it is called the full yogic breathing, I'll tell you later after the practice here. So you can sit stretch, try to place the palms on the thigh. And if you want to have the mudras, mudra is basically the hand gesture which provide you the stability. If you want to go with the mudras, it is fine. If you don't want to go with the mudra, that is also okay here. So we are going to adopt the chin mudra for all the 3 sections. Normally we have the different sections, different mudras, but here we are for the cancer patients, we are using the one mudra, which is the chin mudra here. And we are going to do the some abdominal breathing, chest breathing and basically the clavicle breathing here. So now keep the spine, head, neck, back straight in one line. Inhale, bulge the belly out. And exhale, suck the belly in. Try to make the volunteer movement of the belly movements. Inhale, bulge the belly out. Exhale, suck the belly in. Inhale, bulge the belly out and exhale, suck the belly in. Now gently stop the practice and relax. Why it is called the sectional breathing? Because they want you to use the only particular muscles which breathing practice you are performing. Suppose you are doing the abdominal breathing practice, then make sure that your chest movement should not be happens, your shoulder movement should not be happens. So you have to be follow only with the one areas, only you have to follow with this one breathing areas, and that muscles only should be involved when you are performing the practice. Now let us go for the second breathing practice, which is the chest breathing practice, but we are following the same mudras, but each breathing practice has a different mudras. So inhale, expand your lungs completely and try to avoid the abdominal movement. And when you do the chest breathing practice, remember to slightly do the external rotation of the shoulders. When you do the external rotation of the shoulders, you will be able to basically roll the shoulders back and you'll be able to expand your lungs wider. So exhale, relax your chest muscles. 2 more times. Inhale, and exhale. Last round. Inhale, and exhale. Now after the 3 times, let us go for the clavicle breathing practices. So if you look into the clavicle breathing, we have to basically lift the shoulders up. So again, same mudras. Inhale, lift the shoulders up, and exhale, try to bring the shoulders down. Inhale, lift the shoulders up. Exhale, down. Inhale, up. Exhale, down. And now try to relax your shoulder joints. Relax your clavicle bones here. That's why it's called the clavicle breathing practices, which means the breathing should be happen with the clavicle bones here. And now let's go for the last, which is called the Vibhagiya pranayama, which is called the full yogic breathing also. So Vibhagiya was 1, 2, 3, means section 1, section 2, section 3, and now we are going to the full yogic breathing, which means we are going to combine our breathing and we are trying to lengthen our breathing. Especially in the cancer patients, you see that their energy is low and breathing also becomes shorter. So this is the one of the best techniques to train their breathing patterns. They can basically increase their breathing capacity by doing this. If they are able to do the only short breathing practice, they can just follow the section wise breathing practices. If you feel there is an improvement, they can do it more, then basically they can follow the 2 parts, then they can combine these 3 parts, and if they are able to do it even longer, they can go all the 3 together. So what you have to do is, again, you have to maintain the awareness towards the physical bodies. You have to use the correct muscles while doing the breathing. So inhale first, bulge the belly out, expand the lungs, so roll the shoulders back and slowly lift the shoulders slightly up, and exhale, relax your belly muscles, relax your chest muscles, and slowly drop the shoulders down. 2 more times with the same breathing practice. Inhale, bulge the belly out, expand the lungs completely and lift the shoulders slightly up. Exhale, down. Last round. Again inhale, bulge the belly out, expand the lungs and lift the shoulders up. And exhale, you have to follow the same sequence. Relax your belly muscles, relax your chest muscles, and drop the shoulders down. This is your full yogic breathing, which is a very supportive breathing practices for the cancer patients here. So once you do the breathing practice completed in the sitting positions, let us go for the practice of asanas here. So what we can teach for the cancer patients here, we are going to activate their thymus glands again here, and also we are going to basically activate their groin areas here. So what you have to do is, you can basically stand on the knees here. So once you reach here in the groin areas, basically if you are going to do here, these parts you have to basically stretch up, which means you have to extend. The hip is going to be extended here. Instead of being flexion, you have to do the extension now here. So once you extend the hip areas here, slowly try to place your palms on the waist region and make sure that your knee should be in one line here. And if you feel that back is stiff, see, therapy we are not focused for the alignment. Therapy we are only focused for the specific area. So we can basically compromise with the alignment because your patient is maybe stiff, your patient is not able to basically do. So what is happening, don't try to force them for the practices. You have to basically compromise your practices. Whatever the way they are comfortable, you have to always compromise with your patients based on their situations. Maybe today they are able to do more, tomorrow they are not able to do it. So you have to adjust the practices here. So if they feel the back is stiff, you can open the legs little bit apart, place the hands on the waist region and try to inhale. Again, push the hip forward and slowly drop your head back. And remember that I told you, when you drop your head back, do not close your eyes because you may feel giddy or you may feel weak, so you may fall down. So try to look up and go with the normal breathing. Try to push the hip forward. The more you push the hip forward, more you will have the extension towards the groiny areas, and of course your chest is being activated with the thymus glands. Now inhale, slowly come back, and now exhale, come back to the sitting position. So once you sit here, let us go for the complementary postures. So now same glands, groins area, we are again going to basically do the hip flexion. So now we are going to flexion the hip. So when you do the hip flexions, your glands will be basically compressed. When you do the hip extension, the glands will be stretched. So compression and stretch both will help you to release the more immune cells to boost your immune powers. Okay. So what you have to do is basically keep the feet together here and try to make the fist with the both the hands here. And if you want to place it here, you can place it here. But remember, if the person has the stomach cancer, don't do this. If they are having the liver cancer, don't do this. Only we recommend this for the lung cancer patients. Or the best is to go more comfortable in the easy way. You can put the hands behind, inhale, roll the shoulders back and try to push the chest forward. You can see the chest is expanded here. Here also we have the basically the glands for the immune system, so you can activate here. So inhale, look up, and exhale, slowly bend forward here. Try to bend down more, bring your head down with the exhalation. Touch your head down. Inhale, slowly come back to the sitting positions. Try to roll the shoulders back, and again try to roll the shoulders back, expand the lungs, and again exhale, bend forward and try to bring the body down. Keep your head on the grounds, and once you keep the head grounds, try to relax here because you are going for the flexion movements. So again inhale, go for the extension, again inhale, and exhale. Last round, try to exhale and bend forward. Now inhale, come back to the center, try to relax your hands on the thigh, shift the body weight either to the right or the left, and unfold your legs one by one and come back to the Sthiti Dandasana. You can come to these positions, and now we are going to do the last practice for the cancer patients here. So once you come here, slowly try to lie down with the face down. So you can roll the body down and try to lie down with the face down here. So once you do the face down here, place your palms side of the rib cage and try to drop your head on the ground here. And once you reach here, again inhale, look up and try to bring the chest off the ground. But make sure that there should be no weight on the palms. It's called the cobra pose here. and maintain it here. Hold up. Now exhale, bring the head down, try to put the head down and relax. Again, one more time, inhale, come up. Always try to synchronize your breathing practice with the chest movements. Exhale, down, bring your head down, try to relax yourself. Last round, inhale, slowly come up, and once you come up here now, try to roll the shoulders back. Because when you're doing the back bend, try to roll the shoulders back. The moment you do the rolling of your shoulder joints, then what will happen? Your lungs will be expanded even more. Now exhale, bring the head down and try to relax yourself in the face down. Stretch your hands out, look up and fold your hands one by one and place it on the shoulders, opposite shoulders, and keep the feet apart and relax for here a while. Then slowly come back to the sitting position. You can sit down. So I will recommend these asanas to be given to the cancer patients daily basis. But not only just this, they can also basically practice the other asanas. Suppose if they are having the issues with the liver problems, they can go for the basically the side bending practices like Ardha Kati Chakrasanas and all those practices, triangle pose. You know, all these practices will help to them. If they are having the problems with the pancreas or something, they can do some twisting practices, which is the revolve triangle pose, seated twist pose, half fish king pose. All this practice also recommended for the cancer patients. Not only just that, if they are having the like the stomach and all, so make sure that there should not be so much pressure there, but they can do the little bit like lumbar stretch, bridge pose. All this will basically help them to activate to that parts. That is your physical practices with the breathing which I teach to you. Now let us go for the three pranayama practice I will recommend for the cancer patients, because they have the low energy and they lose their weight continuously. So what we have to do is basically we have to basically work with them in this three pranayama especially recommended for the cancer patients. One is left nostril breathing, you know, which is just inhalation and the exhalations with the left nostril. So this will basically help them to maintain their energy. Not only just to maintain their energy, it will be also help them to keep their minds calm. So they can adopt the Nashika mudra here, and this mudra, this hands they can use as a chin mudra. Close the right nostril here, and you have to go for the very smooth and the gentle breathing practices. See, because the breathing is something which connects your body and the mind. So when you perform this practice, you will feel that you are like in the meditative state, and physically also you will feel that body is becoming energized here. You know, Hatha Yoga says that chale vate chale chittam nischalam nischale bhavet, which means if your breathing is fast, your mind also will be very fast. That's why when we become anger, frustrated, our breathing becomes soundful. So you have to make the breathing practice so slow. How to make it slow? Key point is try to not hear the sound of your own breathing. So you should not even hear your breathing. That slowness you have to maintain into the practice here. So how it will be happens? You have to pay the attention. Close your right nostrils and you have to go for the 5 times basically the left nostril breathing here. So you have to close it here. Inhale and exhale. Inhale exhale. Again inhale and exhale. Inhale and exhale. Last round. Inhale and exhale. Gently stop the practice. Close your eyes and try to observe the changes and feel that your left nostril respiration is very smooth and gentle. Try to maintain. Close your eyes, maintain the awareness. Now let us go for the next pranayama, which is the Nadi Shuddhi pranayama. See, name itself you can see the benefit. Nadi is basically the meridian, which is the energy channel. Shuddhi is the purifications. So it's help you to purify your all the toxins of the body. If there is no toxins, which means there is no autoimmunity process in the body. Okay, so what you have to do is you have to adopt the Nashika mudra, but this we are going to do only 3 times. Okay, not 5 times, just we are going to do the 3 times due to the limited times we have. So close the right nostril here. Try to exhale first with the left nostril to clear your nostrils again. Then inhale through the left nostril. Close the left nostrils and slowly exhale with the right nostril. Inhale through the right nostril. Close the right and now exhale through the left nostril. Continue this process 3 times. Again inhale. Try to avoid the sounds in your breathing. Now close the left and exhale to the right slowly. Inhale to the right. Exhale to the left. Last round. Inhale. Close the left and exhale through the right. Inhale to the right. Exhale to the left. Now gently stop the practice and try to maintain the awareness to both the nostrils. Try to feel the smooth inhalation and exhalations through both the nostrils. And now I will teach you the one part of the PET to feel the energy through the palms. I told you I'm not going to teach the whole pranic energized technique because of the time issues, but at least one part we can do that to feel the energy, and that is called the churning the pranas in the body. So what you have to do is you have to bring the hands up to the Namaskar mudra here, and you have to rub the palms with each other. Just rub for a while, try to feel it, and you'll be able to feel when you are focused on it, So that's the very important to maintain the awareness between you both the palms. Don't rub so hard, just smooth rubbing, and try to keep your palms apart from each other. Try to maintain the gap up to the 12-inch and exhale, bring the hands close to each other. But make sure that do not touch your palms. You can come just 1 inch distance. Again, you have to take it away. Again, try to bring the hands. And now you can feel there is an energy between both the palms, which is pushing your palms against each other. You can feel how the energy is flowing through all over the body. The whole purpose of teaching this to feel the energy aura. It is already happening. It is already around this physical body, but because of it is in the subtler form, you're not able to see it. but the moment you focus, you are aware, you can feel this energy between your both the palms. Now try to rotate your palms and try to feel that pressure, and once you feel that pressure, you will say that your hand is pushing out even more and more. So try to bring it closer. The more closer you bring, the more energy you can feel between your both the palms. Try to enjoy this experience. See, you can feel that there's a lot of pressure between your both the palms. I hope you all are feeling. If you not, you try again and try to feel it. The role of the mind is very important with this practice. You can try to feel your energy aura and try to feel how the strong your energy is. Just you need to know how to channelize and regulate the energy in your body. All these practices basically you have to teach to the cancer patients to feel the energy. Try to feel, you bring the more closer, you can feel the more pressure. You feel your palms is pushing against each other. But this is totally invisible to us. Do not lose the focus, because the moment you lose the focus, you will lose the sensation. So after doing this few rounds, you can rub the palms with each other and try to place to that particular areas where you had cancer issues or you have the cancer issues, or to prevent that particular weak parts, you can place your palms whenever you are teaching the class to the cancer patients here. And now with these practices, let us go for the last practice, which is the very important practice to relax and giving the soothing effect to the nervous systems, and that is called the Brahmari chanting. Brahmari chanting is basically the female honeybee sounds, and that is basically creating the direct resonance towards the head regions, which means it is going to activate your limbic cortex, emotional set. It is going to activate your sympathetic nervous systems. It is going to basically hypothalamus, pituitary glands, all these basically parts will become activate when you perform this Brahmari pranayama. Not only just that, it is also going to activate your pineal glands, which will help you to reduce the melatonin. Your sleep will improve. The people most of the times get the autoimmunity problems because of lack of the sleeps. So that is the one of the main cause of the autoimmunity. So this will help them to regulate their sleep. This will help them to reduce the inflammations in their body with the cancer patients. So what you have to do is you need to basically make the palms and try to cover your ear here like this. And then what you have to do is basically you have to touch the tongues to the upper palate. Why do we need to touch the tongues to the upper palate? Which means we are trying to direct the sounds directly towards the nervous systems. That's why we touch the tongue slightly up to the upper palate. So you can send and you can feel the resonance, you can feel the vibrations of this chanting here, and close the lip with each other like this. Don't compress it, just touch it and try to cover the ear and chant Makara. Once again, inhale. Last round, inhale. Now bring the hands down, close your eyes. Now imagine that all the lymph nodes are activated from the neck regions, from the thymus areas, from the groin areas towards the nipple areas as well. Make sure that your all the lymph nodes is activated. While stretching, feel it under the armpits. Now with these thoughts, bring your both the palms close to each other. Let us close the session with 1 Om 3 Shanti. Inhale. Om Shanti Shanti Shanti. Now gently rub the palms with each other. Do the slightly palming to the face. Again rub the palms and do the massage towards the lungs areas, livers, pancreas, abdominal muscles, back muscles, thigh muscles, knee joint and ankle joint. Now gently open your eyes with a few blinks. Thank you.
Thank you, Master Prashant, for the very informative session and also rejuvenating. So thank you for coming in. Also, we are now open for questions. If there's anyone who want to ask Master Prashant any questions, please raise your hand. If not, we have questions from the chat. Master Prashant, the question is, from Dorothy, as for the standing back extension or bending backwards, should we always tuck our tailbone in or it is in relaxed position?
Okay, see, if you talks about the alignment, I mentioned that words with the patients, we don't work on the alignments. We are only working towards their postures, whatever the level they are comfortable. But when you ask in the general practices, when they do the back bends, they try to arch their back, which means when they do the back bend, they don't need to tuck the core inside, you know. So if they are arching the back, they can bend more, but they may contract the back core muscles. The body will not be allowed to bend more. So in that case, they can relax the belly muscles. They can focus on the bending more as much as they can bend.
All right, thank you. Radha, raise your hand, right? Can you unmute yourself?
Brahmari pranayama, once again, could you repeat, sir?
Yes, so Brahmari pranayama is basically the female honeybee sounds, okay? So that sounds basically we produce, which is basically the M Karash sound. So we are trying to touch the tongues to the upper palate, you know, upper palate. Why we touch the tongues to the upper palate? Because we can direct the sounds towards the nervous systems. That's why we directly, our whole purpose is to feel the vibrations in the neck areas. Why in the neck areas? From here to here, because our whole intention is to activate your nervous systems to bring the balance and provide the soothing impact to your nervous systems, which means it is going to relax by balancing your sympathetic and parasympathetic nervous systems. Not only just that, also it will help you to giving the soothing effect the limbic cortex, which will help you to reduce the thought process in your mind. That's the whole purpose of performing this Brahmari. Thank you, Radha.
Thank you, Master. I have a question for you. So you talk about PET, which is pranic energizing technique, right? How does it help cancer patient? Can you elaborate a little bit on PET? Because I think a lot of us do not understand what is PET.
So see, PET is basically the pranic energized technique which follow the 8 steps, and the whole purpose of performing this PET is to balance the energy in their body. So when you are going to balance the energy in your body, you have to follow the certain practice. So actually this is all totally based on your breathing practice. And what the breathing does in the body, there is 3 types of the respirations we do. One is called the external respiration, one is called the internal respiration, and third one is called the cellular respirations. So when you do the cellular respirations, your energy basically glucose convert faster into the energy. So in the cancer patient, when you see that, they feel very weak, you know, they have the weakness in their body cells becomes weak, their immune systems becomes weak. So when you practice this PET, pranic energized technique, it is going to basically resonate your body cells by boosting the energy in the cells. So which means throughout the entire sessions, we are trying to do the cellular respiration. When you do the normal respirations, your basically breathing is reaching only to the lungs. But when you go for the internal respiration, this is the internal respirations like hands in and out breathing, ankle stretch breathing. This is the internal respiration. So breathing is reaching only towards the cells level. But when you perform the cellular respirations, the energy is, the breathing and oxygen is able to reach directly inside the cells. Then your energy will boost faster comparing to the other practices. That's why the pranayama comes under the cellular respirations.
Right, thank you. It was clear. Okay, I have a question for you also. Is there any type of cancer patient not suitable to practice pranayama?
Actually, the pranayama, just don't keep into the dynamic movements, like don't give them the very dynamic practice. There's a no, like especially they have the lung cancer, especially when you have. So that times still you can teach the pranayama. It's not like you cannot teach, just you have to maintain the movements of the respirations. Don't do it too dynamic. That's it.
Right.
Yeah.
Okay. I have one question also from Savita, probably. She's asking on behalf of her mother-in-law, which she say which yoga for breast cancer should avoid. A patient who have a breast cancer.
Yeah. It is already healed or it is still in the life?
Savita, yeah. She didn't state clearly.
Yeah. Namaste, Master Prashant ji.
Namaste, Savita.
She was treated 2 years back.
Okay.
And like she's still struggling with the side effects.
Okay.
Though we say these are not the side effects, but still she is suffering from those. So like, but she has a very good disciplined lifestyle. In spite of that, like she is having many side effects. So, and plus she is doing yoga also, which is comprising of a Sukshma Kriya, Pran Kriya, and Vipassana meditation. So what you would like to recommend? Thank you.
Whatever the 3 pranayama I teach to just in the class, she can do that daily. What should be avoided? She can avoid the Bhastrika pranayama. Bhastrika is the very dynamic in the nature, you know. So this may create the pressure to the chest area for her. So she should not do this Bhastrika pranayama since it is the very dynamic in the nature. But she can do the left nostril breathing, Nadi Shuddhi pranayama, Brahmari practices, you know. And she can do the cellular respiration and other breathing practices she can do, including pranic energized technique, MSRT. All this is recommended to perform by the cancer patients.
Yeah. Right. Thank you.
Thank
you. We have one more question by Anuradha. In stomach, liver, or pancreas, etc. Stomach bulging and tuck in are okay to do?
Yes, they can do it, but make sure that the patient should be able to take the pressure. If you feel it is a little bit uncomfortable, stop doing it. They can do it, but they cannot create the pressure over there. Try to relax that areas, but related to that other muscles, they can perform the practices. So suppose if they are having the like stomach or liver, so they can do the side bending, provided they should not hold it too long, so pressure can reach inside, and which can maybe, if there's a cyst, it can basically make the cyst to be like damaged or something, so it can create the infection in the body and then person can die, you know. So they can do it, but they should not hold it too long to create the so much pressure over that sides. But if it is the healed and they have overcome from that, please do it, no problem.
Thank you, Master. So I have one last question for you. Can pranayama be done when lying down just before falling asleep?
Yes, they can do the pranayama practices, but they should do the relaxation. There is a few pranayamas, like they can do the Brahmari pranayama, you know, they can do the left nostril breathing practices, you know. Nadi Shuddhi pranayama also they can do, but provided there should be no sounds. They should not do something which is the, like cooling pranayamas also they can do, provided they don't have cold and cough that times, you know. So if this is okay, they can do that. They should not pay so much attention, because pranayama also is a practice of awareness. So sometimes it's alert the patients, you know, and they alert them too much, then what will happen? They may not be able to sleep in the night. They become attentive. Okay.
Right. Okay.
Yeah.
Thank you for all the very informative answer. Thank you. So we're going to end the session here. Thank you, everyone. Namaste.